question or refer to somebody, we just can't take action on public comment. We can ask a question or comment to it. Yes, sir.
I think if you know what I'm asking is that you just, that it's noted in the minutes that you presented as a public, not as a board member, but as an individual of the public. Because I think you were speaking as a member of the public.
I was trying to speak as a board member to
Oh,
recognize
okay.
that training. Okay, that's when I brought it up, and
Well,
I
and
was told
think,
that I couldn't talk to her.
I think what I read was, in some of the emails that I got, if you're going to speak as a public, during public comments as a board member, then we are supposed to excuse ourselves from here and then go over to the microphone.
No problem.
Okay, and then the other thing that I want to bring up is, in the last, right at the end of the board meeting, it says, our board member Shell suggested that a special meeting be held in 2 weeks to discuss the letter that was received by the board members from Dr. Jackson. It's in reference to what he said. But what was difficult for me in that setting at the board member was the way in which you presented that. It was loud. I found it to be very unprofessional. It was almost frightening. And, you know, it's not a way that I would present information to the board, and I wanted to record it that, you know, I wasn't happy with that type of conduct at the board meeting, and I don't think you were either with yourself. And it's by no means a reflection on the board as a whole.
No, it's not, and I apologize for getting heated. The problem was the board chairman wasn't saying anything. The CEO, who's not a member of the board, who comes to the board, was telling me what I could and couldn't say. And she was arguing with me and kept telling me no, 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 and that got me agitated. It's not even her place to tell me what I can't say at a board meeting, let alone to repeatedly tell me no.
I understand
And
that,
so,
but I don't think that, I think it was.
I apologize for getting agitated, and I'm explaining. I got agitated because I ask questions and I get told no or don't have information, and there's no reason for her to even keep talking to me about it when I'm asking a question of the board.
I understand that, but that doesn't give you the right to get loud and boisterous with the rest of us present. And again, I found it very unprofessional.
I'm sorry if it was unprofessional, but sometimes you have to speak up to be heard, and I wasn't being heard. I wasn't being heard.
So it's no, I want it to be noted that it wasn't a reflection of the rest of the board.
Okay,
No, it's not.
so with those, Sophie, do you have those two corrections?
Yes.
Okay, do I have, with the corrections, do I have a motion to approve?
She made that motion, I'll second it.
Okay, we have a motion and a second. Roll call.
Greg,
Abstain. I wasn't there.
Maggie,
Yes.
Rosemary,
Yes.
Ann,
Yes.
and Michael.
Yes.
Okay, thank you. Public comment. Members of the public are welcome to participate in the meetings of the board. When the board chair president recognizes a member of the public for oral comment, the comment should be limited to 3 minutes or less at the discretion of the board president.
Like I said, my name is Marcelino Nuno Jr. I have a couple things I've requested. Some information that I didn't need to get a partial one. I'm supposed to get supposedly something today. Had to do with the budgets for the past 2 years, actuals for the last few years. It seems like I haven't received anything. I received something from the CEO, and it was very vague and partial. And I just want to know what's going on with those paperwork. Also, I'm here representing about maybe 35, 40 people here in Soledad that they want to have an opportunity to hear this meeting. They don't want to necessarily come into the clinic because of the area. They think it's not a suitable place for them to come to, but they do want some type of Zoom meeting that can be set up in order to have a public comment for those. So I think it's restraining a lot of people that they would like to comment. So I would like to have a Zoom possibility that you guys can set up so we can have more public comment. A lot of the community is concerned about certain issues, and I think they should be the ones bringing it up. I'm concerned with a few things, and paperwork-wise is one of the main ones. I haven't seen a portion of any of the paperwork that I've asked for, and I believe it's kind of getting to a point where the state can actually come in and maybe fine the board we would have to ask your counsel, but I used to be in the financial committee for City of King City as a city council member, and what I saw, what was given to me was very vague, nothing at all. So I can't see that as actually people doing their job or presenting us as a public what we're entitled to see. And I'd like to see that paperwork. I still haven't received an answer. I've sent some emails and I haven't seen anything.
Specifically, what paperwork?
I've asked for the budget for the past 2 years, the agenda that approved the budget for the last 2 years. I've requested the last 2 years' actuals that were spent. I've reached out to the state controllers. They've given me some information, but it's not even close of what the total amount that's supposedly the district's using. You're like, almost $10 million short of what I'm being given. So that's a big gap. So I don't think it's acceptable us as a public that we're given partials or maybe nothing at all. So that leads to me to think, is there something going on? Is somebody not doing the job? Is the board not doing their job? Something.
Just one comment, have you been able to find stuff on the website? Because a lot of that's posted there.
No, it's not on the website. You can ask your...
So my recommendation would be to refer that to staff.
Okay.
I got a letter to the board. My daughter is here to read it on my behalf. But I don't have glasses, I don't know where I left them. And I would like this letter attached to your minutes, and you will receive a copy.
I do have a copy right here. This letter is to the board, and it's from my Aunt Esther Bagwell, in regards to the medical care of her mother, my grandma, Esther Bagwell. This letter outlines the deficient medical attention and medical care and lack of communication by the staff of Eden Valley Care Center. Our mother, Esther Bagwell, who passed away March 13, 23, our mother's physical and emotional health was not addressed and managed appropriately. In June 2001, my mom was referred to Eden Valley for rehabilitation services following surgery for a fractured hip by her physician at the Salinas Valley Memorial Hospital. Eden Valley was suggested for several reasons. Number one, Eden Valley has a 5-star standing for their rehabilitation and long-term care. 2, family lives nearby. And number 3, peace of mind for the family that the facility was in our mother's hometown. During her time of rehabilitation, my mother was evaluated for dementia. To ensure her care and safety, the family agreed to continue her care at the facility as a long-term skilled nursing care resident. My mom adjusted and was happy at Eden Valley. She shared times with friends that she went to school with as a young girl. She joined all the activities, bingo being her favorite. Esther started her day at 5 a.m. every morning, reading her Bible and placing phone calls to her kids. Ongoing physical and emotional health decline of Esther Bagwell. This timeline illustrates the lack of appropriate attention and intervention. Physical decline started July of 22. Mom shared ankle pain and said she was given Tylenol for the pain. Informed by Eden Valley, she had an edema and would be followed by the Eden Valley physician. Mom shared that things were changing at Eden Valley, but she could not express any details. December 22. Noticeable decline in my mother's physical health status during a home visit. My mother choked on certain foods and had continuous pain in her ankle. These health concerns/conditions were reported to Eden Valley staff. I was informed to expect an evaluation by a speech therapist and expect a physical follow-up. By February 2023, noticeable further decline in my mother's health status during a home visit. My mother was not as alert and her communication had weakened. She didn't get up early to read her Bible. She slept 95% of the time. My mom choked on everything, including her own saliva, and vomited at least once a day. Given her condition, it was alarming that Eden Valley felt that my mom was physically able to travel 4 hours by car for a visit to my home. Eden Valley was contacted and I voiced my concern. The director of Eden Valley claimed my mom had a UTI based on symptoms I shared. She advised returning my mom to Eden Valley if my mom was not feeling better to take her to the hospital. In addition, she claimed the symptoms displayed are common with dementia. I returned my mom to Eden Valley the next day. Nursing staff was asked.
I'm sorry. Can we get this?
I move we allow her to finish the letter.
Sophie,
Can I finish?
How much more long is?
I have another page I could kind of
Summarize
summarize.
it, that would be great.
Okay, so one incident that was really upsetting is her dentures were broken. I received a voicemail from the social staff that her dentures were in her jacket pocket and it was literally the laundry, the washer, and the dryer. And that they were broken and they stated that it was not their responsibility. Expecting the dentures to be replaced at the cost of the family and blaming her for the occurrence. My mom's diet did not change while without the dentures. It appeared she was not given food or soft food, and how did Eden Valley expect her to eat without the teeth? On March 6th, the staff called and left a voice message. My mom had a coughing episode. Her saturation level was 90% and was placed on oxygen. I immediately left for Eden Valley, spoke to the director. The director felt that it was not in my best interest to drive all the way to Soledad. But upon arriving to Eden Valley, I found my mom slumped down in a wheelchair on oxygen, nearly non-coherent. Her condition was devastating. There was an untouched bowl of soup. I tried to feed her. She was choking on it. I noticed her tongue was covered with a thick white substance and her fingers were very swollen. The nurse took a picture of her tongue, and it appeared she'd never been examined for a thrush prior to this incident. Due to her physical decline, I had her transferred to the hospital. Eden Valley staff was not helpful in helping me understand my mom's health condition, and therefore I had no choice but to get her to the hospital. Eden Valley was
Sum it
doing
up quickly,
nothing
because we-
prior to helping.
Okay, we're gonna refer that to staff, and make sure that we have a complete letter.
I gave you a copy of the letter.
Okay, I'm thinking, there were several pages on that.
There's 3 pages.
1, 2, did the third one get down that way?
I didn't get the, I got.
Well, I need that one back, so we can give it to Ida.
Okay, do you need another copy? I don't have a copy.
That would be great, thank you.
Okay.
Okay, yes, ma'am.
Hi, good afternoon. My name is Ronnie. I'm here not only as a patient that I usually come and see the clinic, but also as a healthcare worker. I am from Salinas, and I've been very proud to, or very happy with the services so far at this clinic. The reason I'm here today is because I saw this in the beginning, and my heart was distraught. Mr. Schill, is there the letter that you're stating that was also on this here, is that's part of the public record? Is that correct?
It's supposed to be a public document.
Where do I get a copy? If it's part of the public record?
I don't know where a copy we've gotten, I just know that once it goes to the board members, it's supposed to be a public document. I believe you can request that from the district, and it should be able to provide it.
Okay, so requesting it from the district. Okay. So the reason I'm here is because as a healthcare worker working in labor and delivery for 28 years and also as an ultrasound technologist for 24 years, not only am I a patient here, but I also refer patients here. And as stated before, my care here has been great. When I hear or when I see things like this, it's a red flag for me to be able to not only come as a patient, but also to keep referring patients here. This no confidence letter, I'm very interested in getting a copy of that, because if there's 4 doctors, 1 nurse practitioner, 2 physician's assistants, and 2 other healthcare workers that wrote this letter, there's got to be something behind it. And once again, as a patient, that concerns me. As a healthcare worker, that concerns me. November was a very busy year for the clinic. 1 person was let go, unfortunately fired. And then this letter was also given out in November. So February, the board received a copy. I would like a copy myself. I'm not here to cause more turmoil, but I want the board to know that even myself, Ms. Salinas, that I'm not from the Soledad area, I care about the district and I care about the healthcare. Because as a potential physician's assistant myself that I applied at CSUMB, I'm also going to be looking for a job once I'm bilingual, bicultural. I'd love to work here, but not under these circumstances.
I'm Kim Stemler, and I am the director of the Monterey County Vintners and Growers Association, wine. So I am long overdue in coming to you to express my gratitude from the depths of my heart, from the depths of our industry and the broader ag industry's support. Appreciation, sorry, I got distracted.
Sorry.
It's okay. So a couple of years ago, COVID started. We had to work. Our industry had to work. Ag had to work. There was this disease. We didn't know how to treat it. We didn't know how to treat the virus. And then finally a vaccination comes, but it wasn't available. And we were searching for everyone to work with that could get it. And it was Ida and the clinic that got it for us, that sponsored, hosted clinics for thousands of ag workers and essential workers and community members. Elderly community members were one of the first, remember? You were so amazingly cooperative, and you were an angel. You made it easy, the staff made it easy. It was so important to us. And because of our involvement, I ended up getting very involved in a lot of COVID efforts throughout the county. And we continued to work together on testing programs, on more vaccination programs. This was one of the best partners in the county. The clinic was one of the best partners and provided the best service for the county. And I think you really need to hear that. There were not higher angels stepping up. This clinic was a higher angel. And I'm so grateful, and our industry is so grateful to you, your staff, to the board for making that possible. So thank you. And I have to apologize, I would love to stay, but we have a tasting room opening in Carmel Valley, so I have to go there now. So thank you.
Mi nombre es Marta Zárate y soy un trabajador comunitario de aquí de Soledad.
Her name is Marta Zarate. She's a community care worker.
Trabajo para el proyecto Vida
She works for the Project Vida
del Condado de Monterrey.
for the county of Monterey.
Empezó enero 2021.
It started in January 2021.
Tuve la oportunidad de trabajar en todo el Condado de Monterrey,
She had the opportunity to work throughout the county of Monterey,
desde el sur hasta el norte.
from the north to the south.
Pero quiero mencionar que algo que impactó en mi comunidad
But she wants to say something that impacted her community.
fue haber trabajado en el Distrito de Atención Médica. Fue haber trabajado.
She worked here in the district
Dirigido por la señora Aida López Chan.
that was directed by Ida Chan.
Ella nos dio la oportunidad de trabajar en decenas de clínicas de vacunas,
She gave them the opportunity to work in the immunization clinics,
donde fueron beneficiados decenas de personas
where people benefited. That a lot of people benefited from the immunizations
de las diferentes comunidades,
for different communities,
incluyendo trabajadores del campo
including farm workers
que venían especialmente en camiones
that specifically came in buses
para adquirir la vacuna.
to obtain the immunization.
La señora Aida realizó un excelente trabajo
Ms. Ida did a wonderful job
en haciendo estas clínicas de vacunación,
in making these immunization clinics possible,
causando un impacto enorme en el condado.
causing a big impact for these communities.
Quiero felicitarla
I want to congratulate her
públicamente
publicly,
a la directora Aida
to the director Ida,
por su trabajo y esfuerzo y dedicación.
for her work
And dedication.
and dedication,
Pensando en nuestras comunidades.
for thinking of our communities.
Gracias, señora Aida, por
Thank
todo
you
el
so
trabajo
much,
que usted
Aida,
ha hecho en nuestra
for everything
comunidad.
that you've done for our community.
Gracias.
Thank you.
So it's wonderful to hear about the things that Ida has done for this community for COVID. Thank you, Ida, for that. But our concern is Eden Valley and what happened to Eden Valley. So, there is the bigger picture, but there's also the picture of the Eden Valley Nursing Home that has been seriously neglected by the board. And I want to tell you that we have written letters. We've asked for those letters to be submitted publicly and attached to the minutes because you only give us 3 minutes. And these letters are far more longer than 3 minutes. So I have not read them here, but I've asked you to attach them. So the previous thing where you said they have to be read and then they're attached, that's not true. And you've attached them. And I will continue to ask that you attach these letters. Otherwise, we're going to have to think about attaching them to the Tribune. And I don't want to go there. So I'd rather have them be attached to the minutes. And I have a letter of which we will be giving you today. And it outlines our continuous concerns about the fact that we have not had the opportunity from the board to address our concerns. If you only give us 3 minutes, you're not going to address our concerns. If you don't sit down with us, with the families, and talk to us about what's going on at Eden Valley, then you don't know what's going on at Eden Valley. Because you're not talking to us. You're giving us 3 minutes, and then now you're saying you're not even going to attach those letters to the minutes. So it's a real dismissive attitude about what goes on for us and what goes on for our family. And let me remind you, my family, we've lived here over 70 years in Soledad. And as you know, my parents had a great bakery. They left a legacy. They loved Soledad, and their tax-paying dollars went to Eden Valley. And right now, I don't even know how many Soledad residents are in Eden Valley. So let's not lose sight of Eden Valley as we talk about this bigger effort in the community. Because sometimes when you do those efforts, you forget about this wing. And this wing has some serious problems. And you need to hear it from us. The other issue, and it's in my letter, but I'm going to briefly point it out, there needs to be a correction to the February 23rd minutes. They're incorrect. It states that Ida reported an update from our nursing home administrator regarding the concerns from letters received from the Wormelli family and the Corjo family. It has never been addressed. We never met with any nursing administrator about that letter, nor has any board member stepped up to meet with us about that letter of November 22nd. So it remains unfinished business. The other thing, and I'm surprised no one caught this as board members, and I'm going to say it, I'm going to go over my little 3 minutes, because there needs to be some clarification to the March 30th minutes. And this is why we submit letters and why we ask them to be attached. So in the public comments, the Alejandra Gutierrez, she came. She talked about what happened to her. And you wrote 2 lines that said, "I'm devastated, and I had to leave." Now that can be interpreted as, I was so devastated because I lost a family member that I had to quit my job at Eden Valley. No, that's not why. She was very clear that she got blamed, and it had to do with the treatment by Ida. But that's not there. Yet on the other hand, we have the comment from the current employee who raved about Ida. You gave her an entire paragraph, and everything she said was correct. So why is it that one person who comes up here and says concerns, you guys don't document it correctly, and the other person you do? You need to look at how you're reporting out your meeting minutes. And therefore, that's why we put everything in writing.
We've given you a lot of time. We'll go over, okay?
Yes, okay, but do you get my point,
I got
Mr.
you.
Stevens? You don't meet with us, you don't talk with us. You sit in this little corner of I don't know where. And, I need to say something about Esther Bagwell because I was there. And it still pains me to see what happened to that woman to this day. It pains me. She died, and I saw what happened. And your nursing staff even came in one night. She, the director of nursing, complained about the food. She saw my mother's dish was incorrect. She saw Esther's dish correct. She saw the bread was stale. She put it in a bag And she said, why are they serving this stale bread to residents? And then she went on to talk in very derogatory remarks about Ida, your director of nursing. What does that tell you about what's going on here? People are not being honest. And you need to figure out how to do honest, transparent communication, and you're only going to do it if you take time to meet with family members, of which you have not done. And if you don't want to do it, I suggest you resign. Thank you.
Thank you.
Wes White, Monroe County resident, John Doe 13K YouTube channel. That was pretty heart-wrenching to listen to. It sounds like there's a lot of dysfunction happening, you know, communication. I mean, I'd be happy to sponsor, I mean, it's easy enough, just do a town hall, you know, special meeting, something, to hopefully, you know, address concerns, make inroads for improvement, and, you know, create better policy and relationships with your patients' families. Because this is your bread and butter right here, if anything. You know, you wouldn't have an operation without these patients. I've asked for public meetings to be placed with Zoom. Please publish what's happening so that more people can interact. I was just at the airport commission saying the same thing. You know, you need to be able to reach out to your constituents more than halfway. You know, and you need to make everything available for them to have that opportunity so you can say with confidence that you did everything you could. And until that point, you're going to get this kind of frustration. I mean, and the minutes thing, I've got an issue with the leadership council for homelessness. 6 people spoke, and their words can't get out, and it got condensed like that. People's homes were just uprooted and taken away. We promise you housing, but you got to go, and you can't be anywhere. So, I mean, there's tragedy on so many levels, so much need in the world, and it's so easy to just be interactive with the people you're working with, you're working for. It's not that hard, and these are easy concessions at the moment, and I know it's more difficult later, but, you know, that's why there needs to be engagement, so we can work through this. There's a lot of pain and a lot of closure that needs to happen because of it. And somehow, some way, we've got to figure out where we went wrong, correct that, and make sure it doesn't happen again. So this breaks my heart. Just here, I mean, I've only been here 3 or 4 months, and I've listened to a lot of heartache and a lot of these are people's lives. You know, it's just not on paper. It's not about money. We need to do better, please. And start with the Zoom. Get interactive. It's not that hard to be a host and, you know, allow 100 to 300 participants. It's really easy. You got the budget for it.
Thank you.
I'd like to excuse myself as a board member and make the comment as a member of the
While
audience.
Rosemary's being up there, I have a question. Is the only problem we need to get the HDMI working? Because we now have her here. I don't know if there's anything else we can do. Can we plug it right to there to HDMI?
We did, we unplugged it, plugged it, it's just not connection.
I'm afraid that most of the people here won't stay till the end of the meeting when Ida gives her report. But somebody complained to the state about the Eden Valley, what's going on in Eden Valley. So the state, under their rules, sent people here, and there were several people that came to Eden Valley and investigated all the complaints that were made, investigated what was going on, and guess what? They found nothing wrong. So I just want to let you know that there's 2 sides to every story.
Nothing wrong, huh? An elderly lady at the front desk having a heart attack. It's nothing? When y'all could just call the ambulance? Nothing!
We're going to wait for just a minute, okay?
Okay. Let me make sure my residents are safe.
Yes.
I'll ask you a question. We'll start.
Almost wanted to jump out there.
At the last meeting, I didn't get to read them. I had 8 employees came to me and asked me to read statements. You want me to go to the podium and get that point?
Is it something that is personnel?
Point the ground.
Raise it then?
It's multiple employees that had issues with their working environment in here.
Can we do that during personnel?
They asked that they be read to the board at the meetings.
Could we do that during personnel? That's my question.
I don't know that I'm confused with the issue of the personnel when we have complaints coming out. Those are public things. We can't take things to a private meeting just because they're uncomfortable. No, I'm saying, I think they're public comments.
Okay.
My question is, do you want me to stand in the microphone?
Let's ask Noel what
and make
the
that
process is.
point? That's fine. The question was, did you want me to go to the podium when we get to that point?
We're going to ask Noel. Okay.
Noel, can you hear us? So I don't see on your agenda a board comment section. Am I missing something, or there's the board comment?
No.
Okay. So then, George Michelle, if you want to put in public comment, but you would be also limited to 3 minutes.
Okay.
Yeah, everyone's.
Okay. I'm sorry.
Just do one comment?
But you had more than 3 minutes.
But she's taking my, I'm taking her place.
Okay.
Okay.
3 minutes.
It'll be quick.
Yeah.
Quick. As someone who is very well versed with state regulators because of my 40 years in healthcare, I can tell you that when state regulators come in and look at things and interview people, they're only as good as honesty by people, and all they do is look at records. So if records are incorrect, they can't do anything. It's a very narrow scope. So when you say things are all fine, it's because the records don't depict everything that went on. Because, you know, is staff going to right all the wrongs? Probably not. So they look through things through a very, very narrow lens. They cannot substantiate every allegation, but it doesn't mean that every allegation is not valid. I just want you to hold that and remember that, because that's a critical point. So when the state comes in and says everything's fine, you better open up your eyes and ears.
I will step off public comment. I was handed these before the last board meeting. Eight different employees came to me and asked me to read their concerns. They were concerned if they brought the concerns up that they may not be employees any longer. That's the word that they used. Problems at the clinic. Morale is low, losing valuable employees, not willing to increase pay. Take care of your employees financially. They will be happy. Not your CEO getting bonuses. Patients are not patients here at Soledad Medical Clinic. Their numbers. More. What happens to patient care? Next person, working under a lot of stress, not working our regular hours, which makes it hard to pay our bills. Too many changes in a short period of time. Working under a lot of stress, doing multiple duties with one medical assistant per provider, hours cut to 4 days. How can we provide the best patient care when we have been working the limited hours for the past 6 months? No overtime and low paying rate, and being directed to make our time cards be correct as if we left on time. Too many complex patients, not enough time to give them the proper care. Difficult to require 24 patients a day with complex patients. Need a social worker. Referral department. I can't read that whole comment, I apologize. I can't understand the statement. Main problem is management. We have no communication. I believe we need to provide health care first. All patients should be treated with respect. Every 30 and 15 minutes would not work. We need to understand providers take longer with patients, especially complex patients. Providers do their best to take care of their patients. Also, there's a lot of complaints of patients about appointments not being available or appointments being canceled and rescheduled. We need to have a walk-in provider. I feel they will help our community. Feeling overwhelmed with phones and visit scheduling, feeling overwhelmed turning over patient care, and very hard to communicate. The last two, typed a little clearer. Staff resigning and management refusing to hire replacements, pulling other staff to cover multiple positions / departments, leading to numerous errors and poor quality patient care. Staff is constantly being pressured about no overtime, but does not staff accordingly, forcing current staff to clock out and continue to work because there is no one else to cover the work that they're doing. CEO, these are CEO comments, does not listen to needs of the provider, staff, or community, blames others for problems that have failed to solve, for example, the phones. Thank you.
Thank you. Okay, anyone else? Okay, we'll close public comment. Communication director, Jaimee.
Hello all, District Board. You're going to be receiving binders later from Sophie that has information that I'm going to be including in my report right now. In the project management report, you'll find my items on the website development under technology. We started working with our vendor Streamline in September, which has a good checklist for making sure we are compliant with special district standards. I am the main contact for any changes or adjustments that need to be made to the site with the help of Sophie, who posts the meeting agendas. People are also able to make appointments with the clinics or appointments to visit residents here, and I'm able to go ahead and assign that to the proper point person, and they can go from there. Under communication, you'll find 3 different areas that I also handle, which is our newsletter, social media pages, and presentations. I added 122 contacts into our SMORE newsletter yesterday, and we have another platform called Constant Contact that goes out to our community email list. The staff newsletter will be going out on Monday, May 1st with a new staff highlight feature. One of our CNAs, Axel Amaro, will be highlighted for Eden Valley, and Dr. Hiron will be for our clinics. In events, you'll find 4 different ones that I have helped coordinate with, which are the Chamber Mixer with Salinas Valley Chamber of Commerce, staff barbecues, our 75th anniversary celebration at the Soledad Historical Society, and our upcoming 75th Gala celebration, which is going to be in September. The first planning committee for that will take place on Tuesday, May 2nd. Under Clinic and the Women's Center, you'll find information about our special programs, which are also listed on our website, so that way the community is informed about different special programs that do take place here in our facilities. And you'll find flyers for each one included in your binders. One for the Food Smarts program, hosted by Julia, the CPSP program, hosted by Christine Del Rosa, the Pregnancy and Infant Loss Support Group, NST program, and Postpartum Wellness Circles. Some other items that I have been working on include creating content with the help of our marketing consultant and photographer. We got staff interviews from 5 different employees. To create a video for promotion and show of the quality of life for our staff, what they enjoy about working here, and all of that. On my own, I worked with Dr. Hiron and got a good picture and biography of him so he can be the next of our providers to be highlighted on our local newspaper after Dr. Esteva, who was just highlighted last month. So it'll be similar to this type of promotion. That we do. We did this for our 75th event at the Historical Society that also has a picture of our former foundation member, Jack Francioni, since we also celebrated his 100th birthday while that event took place. So this type of advertising causes us to raise awareness and shows how long the district has been serving our community and gives our local communities a bit of information about our healthcare providers. While I was interviewing Dr. Hiron, he mentioned that he has been working for the district since 2004. He started his medical career with us and hopes to retire with us as well. An update for our print marketing is that Eden Valley now has a new brochure that has been finalized and printed. You'll also see it in your folders or binders that you'll be getting. So This one incorporates the Eden Valley facility as a whole. Let's see, stores and facility. And has things that they highlight such as 5-star nursing, the physical therapy, orthopedic in private rooms, the customized meal plans that they get. And there's the back of just pictures that they highlight as well. So this one really incorporates the Eden Valley facility as a whole, since the prior brochure only really showcased our rehabilitation unit. So this is what it was before. It's much better for our community as far as information about our facility goes. So for social media outreach, posts that were made on our social media accounts include sports physicals that took place at the clinic, our Easter barbecue and festivities for the residents, a patient story about a mother and her son who were scheduled for an appointment at the clinic, solo guitarist Rose Merrill who performed for our Eden Valley residents, students shadowing medical assistants and providers at the Women's Center, a donation of books, movies, and clothes we received from Eden Valley, from one of our residents' family, the lab coat tour that took place this month, and also Ray, our maintenance supervisor. It was his birthday and we recognized him, and he was a big hit. So that concludes my report.
Any questions? I have just one question. On the making sure that we're compliant, that one program that you issued, that means, and we may not be the person to ask, our minutes, our agendas, and all those things on our website?
Our minutes can be found on our website, on our district site. If you can't find them, you're not looking close enough, and you can find them there. We have transparency on there. We have our most updated agenda, and we are working with the California Special District Association to get that transparency certificate as well. We just need to finalize some things with our attorney.
Okay, thank you.
On the newsletters and messages and policy notes that are going out, are those going out to board members too, or just to the staff?
They're going out to board members now.
Thank you.
I forgot to add your emails in when they transferred over from Sophie handling it to now me handling it, but you'll be receiving this one on Monday.
Thank you.
Okay, Treasury report, Brent, you're on.
Okay, if you can turn to page 10 in your board packet. This is your balance sheet as of March 31st, 2023. You'll notice that our cash and cash equivalents were at $1,594,000. Accounts receivable at $1,790,000. Total current assets $3,739,000. Our payables, our current liabilities are $2.8 million. So our current assets still exceed our current liabilities, which is a loan requirement. So we want to make sure that that stays positive. And then you'll notice down at the bottom, our number of days of cash on hand has increased to 43 days, which is an improvement. It's still not where we want to be. We still have a long ways to go, but it is an improvement over the last few years, or a few months. Let's go to page 11. This is the profit and loss, revenues, expenses, and changes. We are $709,000 behind in medical services for the 9-month period ending. But our contractual adjustments are considerably lower, so in net, we are $365,000 to the positive in comparison to last year at this point. That's in the far right-hand column, the third row down. You can see the 365 right there. Okay.
Contractual adjustments again are.
So we bill out. We may bill out $500 for a visit, but we only receive $250. So the contractual adjustment is that $250. I'm just using round numbers. Okay. So you can see our operating expenses. They're at $10,788,000 as compared to $10,967,000. So we were able to control our expenses to the tune of $178,000 improvement over last year. Our operating income before depreciation is a loss of $361,000 through 9 months. Depreciation of $382,000. So our net operating is a loss of $744,000. We have other income of 271, so our net loss for the 9-month period is 472. Now, just to give you some background, as of January 31st, that was $1 million. So, because of the changes that have taken place in February and in March, and with the increased census, so it's not only cuts in expenses, but it's also an increase in revenues. We've been able to generate $500,000 in net profit for the last 2 months. About $350,000 in February and another 100 and some odd thousand in 130,000 in the month of March.
So the city is out of a deep hole.
So we're beginning to dig ourselves out of a deep hole. we still have a
long ways
hole.
to go.
We still have a hole to continue to dig out. So even though the last 2 months are very positive, just remember that we still have a long ways to go to get financially secure and stable. Okay? In page 12, you can see where the cash, at the top of the page, you can see the cash. We have $978,000 in First Capital, $606 in Mechanics Bank, and then some smaller balances in petty cash and U.S. Bank. Our accounts receivable, this is where the real improvement can be seen. So Eden Valley, last year at this time, our receivables were $313,000. This year, our receivables are $1,440,000. So that's what happens when your beds are full.
That's also the result of increasing the number of beds we have.
Also increasing the number of beds, correct.
How many beds are full?
59.
There's
Full, yeah.
completely full?
59.
Wow.
Okay. And then in the middle of the page, you can see our summary of income by month. You can see it was at about this time last year. If you look at February and March of last year, that's when things were, the beds were not full and we were not controlling our expenses. And so it was about that time that we started to measure those expenses. And it continued all the way through pretty much November of this year, and that's when we started to turn the corner. Is at the end of November of 2022. And there you can see.
It's turning.
It's turning. But it's a big boat and it takes a while to turn it around. Okay, so February, once again, $383,000 profit. March, $123,000 profit. Net profit for the 2-month period, $500,000. Okay?
Are we going to see a breakdown for March? Who made the money? The 123?
Yes, we'll see that here in a couple pages. Okay? So on page 13, you have Eden Valley. You have Eden Valley presented by department, and then you also have Eden Valley reported by type of expenditure. So as of March 31st, Eden Valley is now showing a profit of $308,000. Now
Is that for the year or for the month?
That's for the 9-month period.
9-month period.
Year to date.
Okay.
That's.
Now you have to realize that they still have a responsibility to cover some of the district-wide expenditures.
Oh, okay.
Okay, so in the district, we'll see that on another page. So they have to show on the average of about $500,000 to $600,000. I think our budget shows $650,000 of profit in order to meet our expenditures. So we're still $300,000 short, but if we can continue to do $100,000 a month, we'll get there by the end of the year.
But what I'm looking at is that the revenue for the 8 months is less.
Yes.
But we're making a profit compared to, we're showing a profit.
That's because our expenditures are considerably down as well.
Costs.
Okay.
And we did pull some of it. You'll see general administration. You'll see the 883 this year versus $1,003,000 last year.
Oh.
That's because we pulled a lot of those general administration expenses out so that we could split them between the two entities. So it was people that, like maintenance and general administration, those costs get divided between both entities, not just Eden Valley.
And I also want to point out, we got a email from the Centers for Medicare and Medicaid Services. They issued their fiscal year 2024, and they are going to give a net increase to SNFs of 3.7% beginning October 1st, 2023.
They're going to give an increase of what?
Their Medicare and Medicaid services.
So does that mean like daily?
Mhm.
So does that mean the rate that they pay us per day, per month
Will go up
will go up?
to 3.7% beginning October 1st, 2023.
With our,
So what's that go up to?
So the aggregate impact for payment policies would result, they say for this sector is about 1.2 billion for the entire sector.
But on an individual basis, what does it do for an individual?
You're probably looking right now, about 645 plus a 3.7%. It's about 668 per day.
That's what they're gonna pay us per day?
Versus 645, so it's an increase of about $24 a day, per patient per day.
what is our cost?
Well, but what are we getting right now? 645?
Yeah, we're probably getting around that much right now, but it probably costs us about $700 or $800. Yeah,
And
so
that is
they're,
gonna go up by 3.5%. Okay.
so I just wanted to make sure you guys were aware of that
That's good.
and share that on Eden Valley side.
Okay. So that's Eden Valley, and on page 14, you can see the clinic. So for the 9-month period, we are still at a loss position of $205,000 for the clinic. We're improving.
What was it in January?
I think, I don't have that number with me.
It's about the same.
About the same?
I know we showed about a $33,000 profit for the month of March, and I think it was something similar, if not maybe a little, I think it was maybe 20,000 for February.
So the clinic made some money in February, and you asked me February made $155,766. But the year-to-date loss was $202,863. So month over month, for March, the clinic, I call it a break-even, lost $2,668. Their net income year-to-date loss continues to be at a negative $205,531 as presented here.
So this is where you can kind of see for the month of March, Eden Valley showed a profit of $159,751. The clinic, $33,353. This is before depreciation. So the numbers that Ida just reported had depreciation deducted from it. The district was expenditures of $27,000. So a subtotal of $165 less depreciation. So the total was $123,000 for the month.
So I do want to report to the board that officially I announced at our Wednesday huddle that all staff, 100%, is back to their full hours. So it was.
And that's at the clinic?
That's everywhere.
Oh.
The entire staff.
And in Eden Valley too? Everywhere?
So we slowly started bringing folks on a little bit at a time. That was always the plan. And until the final group came back, and there was like 8 people, I think, left in the final group. So I thanked everybody, appreciated, let them know, for their patience and kind of sticking it out during this time with us. I know it was a sacrifice for everyone. So that was in lieu of, having to do layoffs. And, we had a meeting with LAFCO this week, and they're predicting that 20% of rural health clinics will close in the next year due to financial strains. So what we done wasn't an easy decision, but as you can tell from Brent, we're turning that corner.
When did everybody come back on?
They come back starting Monday.
Yeah, that's very good news to hear that
Thank you.
our general ideal to bring them back has been realized.
I did also want to share that we just recently got our 2022-2023 tax appropriation for the month of April. And we received $176,684.40. Just to kind of put it in perspective, that doesn't even cover a payroll.
That's probably tax over.
So it's an average, if you look at the average number of people in the community, it's about $12.
Yeah, when that's what we contribute to this. So over the years, I've been here, you guys have been here several years, we haven't contributed all that much.
Yeah, it's roughly about $12. So
I just wanted to make sure I shared that with you guys this week.
Brent, you're on again?
The last page, page 15 is, I believe somebody had asked last week, or last month, the district-wide expenditures, what are those expenditures? So for the 9-month period, these are the expenditures that are district-wide that get split between the two entities. So we have salaries, which are mainly administrative, as well as the plant and operations, the maintenance, landscaping, and those type of things. We have IT services, we have benefits, we have legal, we have advertising. Well, this year we have the election costs, we have our audit fees, we have insurance, we have accounting, we have some equipment rent, supplies, and depreciation. So that's $801,970 for 9 months that gets split between the two entities. Okay? And so if you look at that and you say, okay, it's going to be roughly maybe $1 million by the end of the year, Eden Valley and the clinic have to show a profit of $500,000 in order to cover those expenses.
And we remember we're nearing the time where we're doing evaluation season here. And as you heard earlier, there is an expectation by all staff. We also surveyed staff, so we know their responses already. And they want increases in salary. So controlling these expenses, legal expenses, and all those other things is important so that we can be able to provide those. And we have every year, for the last couple of years, we have provided increases and bonuses to staff, and we will continue to do so as long as we can. So controlling expenses, that's the way we're going to do it. And controlling the visit count and the census as well.
A couple of questions. As far as some of these things like advertising, legal, and election costs, those are high numbers. And election costs, we have no control over?
We do not, because there was more than what do you have, 1 or 2 positions?
Yeah.
2 positions. If you have a 3rd position, then you're responsible for paying that cost associated with what we did, so it becomes a full election.
And then advertising is newspapers?
Newspapers, social media, the websites that we've upgraded to, all of the auxiliaries things. So what will happen, because we had to go rev up a little bit to do the setup, you're going to start seeing it come down.
And then legal?
Legal is,
which brings up a question to Noel over here, is I got an email from you, but I didn't ask for it, and it was just, it was, I would think that could have gone to Sophie and then, to save the expense, and then passed it on to
You still had
everybody.
to generate the information. That's what the cost is. It's not in the email to you, but generating that information is what costs time and money.
But her time to submit the email, they bill by email, don't you?
No, it depends on what the email was. If it was a general informational email, no, we don't bill for that.
Oh,
We do that as a courtesy. If it's an email where I'm providing advice particular to the board that requires us to render an opinion, then yes, we do charge for that. So it depends on what it was.
Okay. What did we spend in legal last year with you?
oh, not,
I'm sure it was a lot less.
oh, not anywhere near.
No?
If we hit 10,000, I think I'd be surprised.
Wow.
That's the treasurer's report. We'll go on to the budget report in just a minute.
One second, quick question. So you guys on the cash flow, increase in line of credit, 250,000. That increase, we already had a line of credit that was maxed out and we renewed it, but you have another $250,000 we added that? Or what are you saying?
No, so during this fiscal year, at the end of last fiscal year, or at least as of March of '22, okay, we had not drawn on that line of credit. We drew on that line of credit as things started to turn.
Got it. And when we renewed it recently, we already maxed out. That's what you
Yes.
said. Got
Just
it.
to
Thank
clarify,
you.
we have not renewed the line of credit. We are on an extension that expires at the end of June.
You just voted at a meeting to approve extending the line of credit.
Correct. You didn't renew it though. You only extended it for a period of 90 days. It's just a clarification. When you renew it, it gives you a time frame of 12 months where you're responsible for maintaining the covenants and conditions of that loan. But right now, what we're doing is we're basically on a hold while we go through the financial analysis because of the financial burdens that we've had and the financial setbacks. They're taking an extra look before they renew it. We don't foresee any issues, but that's why they're taking a cautionary look before they renew it. And once we renew it, I'll come back to you guys and we'll do a full renewal again for 12 months.
Any more questions on the treasurer's report? If no, I'll entertain a motion to approve the treasurer's report.
I move we approve the treasurer's report.
Okay, a motion, do I have a second?
I'll second.
And seconds. Roll call?
Greg,
Yes.
Maggie,
Yes.
Rosemary,
Yes.
and Max.
Yes.
Okay, now we're gonna go on to the budget review, and that starts on page 17, correct?
Yes. Actually, page 16.
Okay.
16 is your actual budget. Is it 22, 23?
Can I interrupt real quick? I'm sorry to interrupt. So I just need to get on the record. We had recommended that in the context of the budget approval, that Director Shell recuse himself from that portion of the budget that is related to employee salaries, because his wife is an employee of the district. So not with respect to the entire budget, but that the board bifurcate the salary discussion from the overall budget discussion. So I just want to make sure that was on the record for the board clerk, and then it's up to Director Shell to decide whether he wants to recuse himself and follow that guidance or not.
I had two questions about that. One, so that would apply to Maggie because her daughter's an employee and not same household. And second off, there's no breakdown. The smallest breakdown I see for salaries is $2,200,000 and something. If my wife gets that, I'd be happy, but she doesn't. So I have no idea what part of that is her salary. I'm not seeing that kind of a breakdown. It's not even close to a breakdown. Go ahead.
So Director Campo's daughter is not considered an immediate family member because she's not a spouse or a dependent, so the same rules would not apply to that relationship.
Okay.
And with respect to the salaries, because your wife is in her own classification, by approving the overall salary, you are by extension also approving her salary.
I don't get enough of a breakdown to see her classification in this paper. I have no idea what that classification is. It's not that much detail.
She's the only nurse practitioner.
There's no nurse practitioners listed is what I'm trying to tell you. All it says is salaries, $2.2 million for the salaries for the clinic. It doesn't break down by nurse practitioners and doctors and PAs. I don't have that kind of detail.
I understand, and it's just the guidance is, we don't represent you personally, so we're doing this as a courtesy, and so our guidance is that because that number includes your wife's salary, and she's in a classification by herself, there are no other MPs that are employed by the district, that our recommendation is there's a conflict of interest there, that you should recuse yourself. Now, you're free to not do that. I just need the record to be clear that that was the guidance provided, and you didn't want to, you don't want to recuse yourself.
Well, I might. That's why I was asking those questions.
Does that apply to benefits then too, or not?
It does not apply to benefits because they apply to all employees equally.
Oh.
So Director Shell's wife is not carved out in a special classification for that. So that's really where that nuance happens. If there were 5 nurse practitioners at the district, then there wouldn't be the conflict. But it's because there's only 1 in that classification.
So that means we should see those classification breakdowns? All I see is large numbers of salaries. I don't see a breakdown. So, The other question I had is, so this is our detailed review and approve this. First off, we know this is what we're using because we've been using it for months, even though it hasn't been reviewed. But do we have last year's totals to compare to this when you're approving a budget? Normally you look at last year's totals and some of these things broken down, or this is the detail we're going to get, we either approve it or we don't.
We're not approving a budget, we're going through it and to see where we are in the budget process. This is what we budgeted, these are our costs.
But we never approved a budget that was due September 1st, that's the point. That's why we're doing this.
We did approve a budget.
We never approved a budget.
So before you get too far into this, I just need to understand, Director Shell, are you not going to recuse yourself?
I'm not sure, I might recuse myself from the vote, but we're not even close to a vote because we're not approving a budget anyway, so what am I recusing myself from?
Oh, I thought the eventual motion would be to approve the revised budget.
Well,
Is that not correct?
part of the point I'm making, we have never presented a budget for this fiscal
Okay,
year.
it is revised budget, I'm sorry, I didn't read
Well,
it.
but, okay, that's fine. That's what I've been asking for months. If this is a revised budget, where's the original budget? There was never in the minutes of a meeting where we approved a budget that was due September 1st. I've been asking that since my orientation. And in June, in 2 years of minutes, there's one discussion of a budget, and in the June meeting, the board approved the proposed budget, which I pointed out to Ida was lacking. It was $4.7 million for last year. This year, didn't have anything for the clinics. She told me that the proper copy was brought out to the meeting, but I've never seen that in the minutes, and there's never been presented to the board this budget. Until last meeting, when it was in the summary, the board has never approved, in 2 years or 25 years, has never approved the budget. So this, when you were telling me that they were working on the budget for next year, the budget that was due September 1st this fiscal year has never been presented until now. So we have to receive that to approve it. But we're given breakdowns of how we're doing towards the budget. So the district is using this budget as a guide, but it's never been presented to the public or to the board for approval before now. That's my claim, and that's what I've been asking for months.
This is the first budget that I've prepared.
The Brent has, we prepared one internally.
Okay,
We transitioned to him to prepare it from now on.
Okay, so we had a budget prepared
But-
internally.
So the statement I'm making, so we report this, back in June, it was presented to the board, a proposed budget that was very lacking, and we have to, and then by September 1st, you're supposed to approve the budget for the year. And my point is, we never approved the budget for the year.
In June, they approved the budget,
They approved a proposed budget that was very lacking,
but
and,
they approved the budget.
Yeah, it was
okay, a proposed budget, not a
But
budget. And the words were proposed budget, and it said approve the proposed budget. The law says by September 1st, you have a public meeting, invite the public to review it, ask questions, and approve it. And that's never happened. That's what I'm talking about.
I'm not to argue with you on this, Max. This is the first time, I'm going to be honest with you. Steve never proposed, never.
It doesn't mean the law changed.
I'm not disagreeing with you on that. I'm not disagreeing. It is a need that needs done. We're not arguing on what needs to be done. So I don't know the argument. This is the process we're trying to do. It was one of the directions that I got at the very beginning. We need a budget. That was direction from this board.
Good.
Okay, so we're all on the same page. There's no need to, we're not fighting over something that we're different on.
Okay. Okay. So the only other thing is, we're talking about, we had to cut benefits and cut wages to save money, but we don't have breakdowns on some of these things. And we're not cutting executive bonuses and pay raises, but we're cutting our lower wage people. And where's those numbers in this budget?
Other people got bonuses.
Some other people got.
We did not cut anybody's salary except for the furlough, for the 1 day off.
Yeah,
We did
and
not
other
reduce
people,
anybody's
as part of their.
So you didn't cut their salary, you reduced their working
I just
hours.
want to make sure the representation is correct, Max. We did not do that.
Salaries weren't changed.
Correct.
We cut their hours, which is a reduction.
And now they're all back in hours and
And we
full,
stopped contributing to their retirement
based on the
fund.
financial decision that we had to get back on tracking what you heard
Whose
today.
financial decision?
CEO.
But that's the point.
And the board.
The board hasn't.
The board made the decision.
The board hasn't discussed it. It's sure not in the minutes that the board had discussed it. If the board had discussed it, what happened is you went to a meeting, made an announcement, we're gonna make these
That
cuts.
is not,
and
that
you-
is incorrect.
Well, then you
We followed
show,
standard procedures, meeting with the board president, discussing these things that we're changing, and that was standard procedure of what has been done in the past now.
well, that's not the law.
That hasn't
The board
changed. I
president,
understand it's not the law, but you're asking how is it done procedurally?
okay,
And that's how it was done. We have now adhered to the new things that you have brought forward in following what you are suggesting, and this is why the budget is presented to you today. And you still don't want to move forward with the presentation.
what I'm saying is
So
that
we are
there's been
unclear of what you're
I'm saying there have been
asking for.
several times when you meet with the board chairman and take action, and the rest of the board doesn't even know about it.
That is untrue.
That is
The
not
board-
true.
The board knows about it.
But, well, when
We do not meet in a silo as your representative.
when, back in December, and I brought this to the board and it got ignored, and Greg said that's a Brown Act violation, and sent it to you and you never answered it. Back in December, no, late November, after the board meeting, the board chairman wrote to the director of the clinic and said, wow, what's the problem? What are these surprises? And she answered him back honestly, and the board never discussed those items she brought up, but the next day she was
What does that have to
fired.
do with the budget?
It has to do with,
Right now, we're just discussing the budget.
Miss Chan, you're not controlling this
Wait a minute.
meeting.
Wait, please, there's,
Yes, sir, I will listen to you. She's not controlling this meeting.
but you're not gonna yell at people. You're not gonna yell at people. I am not yelling at you.
No, you're not.
No one's yelling at you.
Then, my point is, you're supposed to address this, not anybody else.
When, just, because this is the part that makes it difficult, because we're working for the same goals, Max. We are working for the same goals. And you're acting like we're fighting you. We're
I
not.
have been being fought for
Wait,
information since the beginning.
we're doing a budget.
Yes.
That's something we want all along. We're not fighting you. We're trying to work with, but it's not a fight. And you're making it a fight. You're making it a fight. And that's not what we're doing. We are trying, like any organization, there are things we need to do better.
Yes.
I'm not arguing that point. No one here is arguing that point. There are things that I brought up to staff that you don't know about, none of these other people know about necessarily, because I'm working with the staff to make some corrections.
But
wait a minute, let me give you an example. There should be training in here of our staff for NIMS, National Emergency Management System. That's just something we need to have done. There are things that I brought to Steve for action. Nothing happened. So we're working to get these things done. It shouldn't be a fight. And that's what it's ending up being. But we're working all for the same goal. And I wish that would come through to you.
I recognize the same goal. Part of what I'm saying is, but not one of us should be telling the staff what to do.
We're not one of them is, when I went to the staff and said, we need to work on this, I knew that. We've talked about NIMS, we've talked about this here, about the active shooter. We've been talking about what the police department has been doing. It's not done in secret. Okay? But so we are trying, like any organization, we can all do better. I'm sure that that the school that you teach at could do things better. Okay, and so let's work on this cooperatively and move forward to make the necessary adjustments because we're all agreeing that there are a lot of things that were done previously that needed to be corrected. Those of us around knew about some of these things and we pushed Steve on that. Didn't happen. But we're making progress on these things. A lot of progress has been made. And I would hope that you will acknowledge that. But is there stuff still left to do? Absolutely. So, now, can we continue with this?
Yes.
Budget review.
I'll recuse myself from the budget, that's what I mean.
I think it was just a part of.
I know, but I'll just recuse myself from the budget, it won't be a problem.
So Director Shell, I don't want you to have to recuse yourself for more than you need to, because if you do recuse yourself, that would require you to not be in the room anymore.
Right.
And I don't want you necessarily to have to do that. So my recommendation would be that the board discuss the salary portion of the budget without you in the room, approve or disapprove that. Once that's done, you come back in and there would be a discussion of the entire budget with you in the room, and all of you would be able to vote on that.
So that means you need to go to the medical clinic, salaries, $2.3 million, and that's the part they need to discuss because their salaries aren't making no sense.
Correct, that's our recommendation.
Okay.
So it would be bifurcated from the rest of the budget.
Can we do that first?
Yes.
And then,
So
okay.
I recuse myself, I step out, when you're done with that part, we can talk about it.
I'll come get you, okay, Max?
Yes.
It's on page 16.
16.
Yeah, right at the top of the corner.
Okay, right
So
there.
the part that he's
Not
able to discuss is the salaries for the medical clinic, which is 2.2 million. I think it's important, and I will repeat myself when he returns, that this budget, was prepared 8 months into this fiscal year. And so it's not like we were looking at this at the beginning of the fiscal year saying, okay, what are we going to do for the whole fiscal year? It's based on what the actuals were as of 8 months into this, and then what we project for the remaining 4 months. That's how this budget was done. Okay? And what it takes in order to get our budget to a break even. Okay, so what I've done for salaries, and since we can only discuss salaries, is I've taken the actuals through the month of, I believe it was February, when I originally did the budget, okay? I did it through February, and then I said, okay, based on our salaries for February, I then said, okay, 4 more months of the salary would bring us to $2,235,975. That's how this number was derived. So it's not that, as we do the budget for this coming fiscal year, we'll be able to look at each individual employee, figure out how much their projected raise is, if they have a raise, we'll be able to project how many medical assistants we want, how many, those type of things. But for this purpose, because we were doing this late, we just took actuals and then projected the remaining 4 months. So that's how these salaries have been derived. And that detail is available if you want to look at the detail.
And I just want to share, the proposal is based on what's going on right now, but I have to stress that salaries right now are very in demand. What I mean by that is a normal LVN, for example, would cost you about $32 an hour. New LVNs coming in is about $45 an hour. So it's really, really challenging right now when it comes to, this is a good estimation, but I just want to preface with saying that those salaries could jump substantially because right now the pressures are, there's an adjustment in the market happening right now with salaries. It's not quite there, it's already happening. I can see it in other areas and other states. They're starting to reduce down. They're moving away from that COVID, increase. It's going to take California a little bit longer to get us there. And so we might have some inflammatory issues happening until then, until the things start settling down. But that would be the only thing that would probably change this number, is that right now.
And then where would you, okay.
So let me go up because, yeah. Okay, can we just take a vote on that one item?
Just the salary.
Just the salary. Okay, so I'll entertain a motion.
On the motion.
Do I have a second?
Wait a second.
Okay. Sophie?
Greg,
Yes.
Maggie,
Yes.
Rosemary,
Yes.
and Ann.
Yep.
Okay, I'll go get Max.
Yes.
describing and talking about the salaries, I had to present to them how this was derived with the budget, okay? So I want to go back and I want to explain that to you so that you can understand where I came up with these numbers, okay? And I want you to know that detail is available, but was requested not to be presented in this packet. So, I mean, I have the detail, you just need to let me know what you need to see. And typically, I've served on boards, you know, most of the boards I've served on haven't gotten into the detail. I didn't want to know how much we spent on postage. I just needed to know, you know, are we within our allowable, you know, are we breaking even? So that was just my own personal, okay? So these numbers, I was asked at the conclusion of January, February, somewhere in that time to come up with this budget. I worked on it in March. At that point, I had actual numbers through February. So I took the actuals through February and I said, okay, if we project the same, for example, in the area of salaries for Eden Valley, I could take, you know, our director and say, okay, his salary or her salary is so much, multiply it by 4 more months to get us to the end of the fiscal year, this would be our budget number. That's how this budget was derived.
Thank you.
Okay? So, you know, those numbers are available and I can provide those to you if you want to see more detail. The board just has to come up with a, you know, what they would like to see, and then we can present that.
The reason I was asking for detail is we're getting to the point where we have to take drastic actions and stop contributing to retirement funds and cut hours. And, well, what else are we spending money on? We're spending money on ads and things like that. Well, if we don't see what we're spending money on and what those professional fees are, how do we analyze? My concern is that the board itself has no idea if we needed to cut hours and or fix if there's something else we can do. And the board's supposed to have that big picture oversight, and then the CEO carries it out. And it was just left at that level to do that. And that's why I'm asking for more detail. It's very hard to look at this right now in more detail to make a decision because
there isn't much detail presented here.
And that's right, and it's hard to dive in. So thank you for your answer.
Okay, and so as we work on the budget for this coming fiscal year, you know, we can present that detail so that you can look at all those, so that you can have that as we make decisions moving forward. This is, you know, late in the year, attempt to make sure that we have a budget.
And I appreciate your effort on that. I acknowledge that.
Okay. All right. So with that said, then, what you have here is you have a budget of $20,916,500 in gross patient revenues. This is on page 16. Okay? And then the annual budget is in the far left column, and then you can see Eden Valley, the medical clinic, and the district in the columns to the right. So I'm just going to go through the annual budget, and if you want to look at anything particular to any of the entities, we can do that as well.
So last month you put a bigger breakdown, but other than this is 1 month farther, it's pretty much the same.
Yeah, it's just a summary of what I did last month. I think it was like 8 pages long or something, and it had all the different line items, and I was told that it was a little overwhelming. And I know a lot of people don't like numbers like I do, and they just look at it and kind of go, oh no, I'm not going to look at that. So I tried to make it so where you can look at it on one page and go, okay, this is our budget. And if you want detail, then just request it. Okay? So our total revenues after the contractual adjustments are $13,840,000. We have operational expenditures of $12,693,000, bringing us a gross profit margin of $1,146,775. And then we have our general and administrative expenses, including depreciation, of $1,558,550. And our net margin there is a loss of $411,775. Typically, I would want that to be break even, okay? But we do have our property tax revenues that we can use to offset that. We have grants and contributions, but we also have interest expense, and those are all other items that are listed down below. And this is presented in a format that mirrors our audit reports. So when you look at an audit report, you can then say, how does it compare with our audited financials? Okay? So we're showing a loss of 411,000, and then we have property tax revenues, grants and contributions, which then bring us to a break-even budget. Now, the other thing that is not presented in this budget, which I think the board needs to know, is that, you know, this $1.2 million adjustment that we have at the end of each year, the PPS settlement with for the clinic, that is not reflected in here because we don't know what that number is. We just got the number, the auditors gave me a preview look at what that number is, and it's going to be about $1.2 million for the prior fiscal year.
That we have to pay back.
That we have to pay back. That 1.2 is not reflected in here. So we really should not be breaking even here. We should be showing a profit of 1.2 million so that we break even. Okay, that's our goal moving forward, and our budget for next year, you know, hopefully we're working toward not having to pay that back by just having the revenues reduced on a monthly basis.
So they are going to do that now. The auditors will present next month is the plan. We have signed, we will sign the document which will allow us to discontinue those advances. It's about a tune of $125,000 per month. And so the clinic's going to see another contraction unless we can get more revenues generated from the clinic's visit counts. They're going to have a contraction of $125,000 above what they have right now. But that's the only way we can find that we will remove ourselves from having that excess and living beyond our means, basically, is by doing that. And when you take that number and multiply by 12, that adds up to nearly $1.1 million. Because remember, we're in the rears 2 years right now. We've just only paid 19. You still have 2020, 2021, 2022, and how many months in 2023? And at a tune of $1 million apiece. So we have to put in reserve in order to cover just the 1 year. We have to bank at least $83,000 in net cash every month in the savings account in order to break even to be able to pay off that debt.
We can do that, right?
That's the goal.
That's the goal.
Okay.
That's my goal.
And they overpaid us because
Steve made a decision in 2015, because they were having financial woes, to take an advance at a recommendation by the auditors of our Medi-Cal payments, which in light of, they never predicted that the interest rates would be at an inflammatory rate of over 8% that we're paying the state. And you only get 30 days, 60 days to pay off that debt. Otherwise, if you don't pay them within 60 days of $1.1 million, you then can make an arrangement to pay them over a course of a year at 8%. They never planned on that. And they planned on having the $3 million that they used for the construction loan of the Women's Center. They depleted our cash and left us, when I came here, we only had 30 days of cash. You tell me who can run on 30 days of cash. They ran a business in 30 days of cash. They had this outstanding debt that they had to pay. This was a way to have cash coming in, not anticipating that the interest rates were going to go as high as they did, and that they depleted all of our assets to pay for the Women's Center.
instead of financing that, capitalizing it.
You're correct.
Which they never did. And I only financed enough to pay the outstanding debt. I didn't replenish we should have got $6 million in a loan rather than 3. And I only got enough to pay for the outstanding balance of the third-party settlements for 2 years. You can tell, we don't have enough. We have $998,000 in cash. We need $1.1 million. If we get a payment due today, we don't have enough to pay it.
And we have no reserves.
And we have no reserve. Hence all of the reductions that we're having to make.
The other problem is when Steve did that in 2014, there were a couple of things he was trying to do. He said, that's when the clinic expansion came in, we thought that would create more money. And then later on, and if I correct me if I'm wrong, please do that, okay? And then the idea was to cut the number of beds in Eden Valley, make them suites. And that would maybe, and it didn't, it got worse. And Stephen, the accountant who made this recommendation, did not take care of the structural problems that created the need to have that extra pay. And so what we did is we dug the hole deeper and deeper and deeper, and that's where we are right now.
So the loss
Does that make sense? I mean, you're in agreement, so.
That loss is about $1.3 million we lost a year, or to a tune of $17 million.
That would, because of the Eaton Valley, the loss of the beds, we lost money there.
Over 8 years.
Yeah.
And we probably wouldn't be anywhere near where we're at if that was not happening.
Okay.
Thank you.
If I,
What's done is done, and
You
so we move forward.
answered the question, thank you. Now I have a better understanding of where we're at.
Okay. So, I'm here to answer any questions that you may have. The remaining pages behind it is just a budget to actual. It shows for Eden Valley, it takes the Eden Valley portion of the budget. It says for 9 months of that budget, this is where we should be at. So for example, on Eden Valley on page 17, if we lived by that budget, we should have $487,000 in profit. We have $308,000.
I understand that calculation, so that's very clear.
I'm just making sure everybody else does it, okay? And then, so the same thing for the clinic on page 18. We should be at break even at 9 months. We're at a loss of 205. And then on the district-wide, we should have expenditures, net expenditures of 490, more or less, and we're at net expenditures of 576. Okay? So, that kind of gives you your budget actual. Hopefully that will be, as you understand and as we work on that budget coming up in the next 2 months, that, these will mean more to you because you'll be active participants in the budget process. Okay?
any questions of Brent? No. So entertain a motion. Yeah, this one we did, did we get the treasury reports?
You approved the treasury report.
Okay, I'm gonna, don't get over. Okay, the budget review, we're going to approve the revised budget. Now, keeping in mind we're now doing the revised budget with the exception of the salaries which we previously did. So I'll entertain a motion. Oh, pardon?
Yes.
Okay, I want to make sure, thank you. So, does that make sense? Okay, so entertain, Sophie, you got that?
Yes.
Okay, well, I'll entertain a motion to that effect.
I'll make a motion.
Okay, Ann, made a motion. Do I have a second? Okay. Motion and second. Please, roll call, please.
Greg,
Yes.
Maggie,
Yes.
Rosemary,
Yes.
Ann, Max.
Yes.
Thank you.
I have one closing. So, like the employee benefits, that number includes if we were making the contributions or if we weren't making the contributions, and the fact it sounds like there might have been some overpayments last year that's got to be balanced in. Is that all included in that number?
Yes.
What you're saying?
Yes, that's in there, payroll taxes are in there, workers' comp is in there, health insurance is in there. That's all of those items.
Okay. Have you finished?
I think I'm done.
Okay. Thank you.
Thank you, Brian.
Just in time, the alarm went off.
It's the phone.
Oh, that's the
Somebody
phone.
pushed it in their phone.
Okay.
They do that all the time.
Okay.
May I be excused?
Yes, thank you very much.
Thank you.
Thank you very much.
Have a good evening.
Okay, foundation report.
Okay, the foundation met before this meeting, and Maggie reported, if you walked in to the meeting from the front door, you may have noticed the basket there with all the flowers in it. Did I say Maggie? Yes.
I'm like, wait, she wasn't here.
Okay, anyway, Jaimee has been receiving the checks and the ticket stubs for the quilt raffle, and she's made flowers up with people's names on it, and so she says she's getting so many replies, she's having a hard time finding room for all the names. So, so far, 450 tickets have been sold, and we've been able to receive $5,000. But more are still coming in, and this money is going towards the new beds for the patients. And we have 6 beds that will cost $10,000 So we haven't made enough money yet to pay for these, but we do have money in the bank. So anyway,
You're getting 10 new beds?
six
Six.
new beds are 2,000.
Oh, I didn't know.
Yeah. So, anyway, so that's where we're coming along.
Is your raffle better this year than it was last year?
We don't know for a while yet, because we have the drawing in May.
No, you're still
collecting money. Money's still coming in. So.
Okay. That it? Okay, thank you very much. Okay, LAFCO update, this, I will refer to this page here. Steve, and I'm going to put me up with you if I screw up. In about 2014, went to the special districts and said that we're not making a profit and asked for a special dispensation so we didn't have to pay our share to the LAFCO expenses. And we had to do that because to the special districts because that was the group we had to get approval from.
So it's on page 20.
20.
20.
I'm sorry, I should have told you that. I'll wait for you to get there. And if you look at the 1, 2, 3, 4, 5th column, operation income and loss, you see this is the audited losses for our operation. And you can see we lost a bunch. And the result was that we didn't have to pay. And you remember, it was when we started in 2014, 2015, around $20,000 our share to LAFCO, and now it's up to about 25 is what we were told. They want us to present, to have Ida write a letter saying when we become profitable, we would be more than happy to pay our fair share. So that is that correct?
Yeah.
Okay, so that's kind of where we are on that. So any questions on that from anyone? Either Ida or Ida.
Happy?
Huh?
Did you say we'd be happy?
They would be.
What's the little benefit that we get?
Well, and it's not, it's almost like we don't have a choice.
You don't have a choice.
I know it. That's my
This is
point.
what, this is
But see,
the-
when we come, we're required to have, the municipal service review.
Well, and aren't we at a not-for-profit agency?
No, we're a type of, we are a type of
Public agency.
public agency, thank you, Noel. We're a type of public agency, so we're not the 501c3 I think about.
And see, right now, of the special districts, SVMH is playing half, so they're taking a larger share. So we're really, they're a lot, when we look at these cemetery districts, like way down south, they don't, and then they're showing a profit. So my question is it all right that we direct, I just sent a letter to Kate, do you need a motion? Motion on that, do we?
Let me see. It's not an action item.
No.
So
Just direct that staff?
Yeah.
Okay, we're okay with that consensus? Okay, thank you very much. Okay, district CEO report.
Oh, can I just add before we
Go ahead.
head on to the next one, sorry? We did get an email back from the chair. It says, Ida and Greg, you have a beautiful facility. I thoroughly enjoyed the tour and time with you. I am looking forward to another visit in the near future. Your passion and dedication to your community is encouraging. I'm a fan. Who's that from? That was from the chair of LAFCO, Mary Ann LaFell.
So the chair, she's not the chair of LAFCO. She's the chair of, she's actually
She's the chair of LAFCO.
Okay.
Your Kate McKenna is the
CEO,
the
yeah.
CEO. That's
Go-
what
go- go-
executive
Right here?
Yeah, yes,
Yeah, they came here. This week, Monday.
Monday.
No, Friday. Last week, Friday.
Yeah.
Sorry. Monday. Last week, Friday.
Okay.
Was that a surprise visit, or did they know they were coming?
They knew we could-
They
wanted
scheduled it with us to go over this.
to discuss this. Okay. CEO report.
Yes, all right. So, good afternoon, everyone. I hope everyone is enjoying the nice warm days. I know we had ice cream for the residents today. I don't know if you noticed that everybody got a cup of ice cream. It's so beautiful outside with all the flowers blooming. I'm happy to report that March 1st, we got confirmation with the final approval from OSHBOD, now known as HCI, to bring to a close the power outage project we started over a year ago. Right now, we're working with the insurance agencies to get reimbursement for the loss that was undertaken. And it's probably about 140, 145, if not higher. I have 184 in my notes just because there's some still outstanding bills that need to go through. This process does take time as the adjuster has 9 insurance companies that provided coverage that she has to work with to get the reimbursement. I'm happy to report that the district was eligible to receive the Department of Health Care Services to help stabilize and retain California healthcare workforce. This week, on Monday, this was due for continuing to manage the COVID pandemic. They issued this week $1,000 to every employee, or we issued on their behalf $1,000 to every employee this week, excluding executive, which would be myself. So there was a total of $98,000 distributed. $58,000 went to Eden Valley, $3,000 went to the providers or doctors, and $37,000 went to clinic staff. We talked already about the tax and the Medicare increases. We talked about LAFCO. I do want to go over the Eden Valley report. So Eden Valley, we did receive in March a complaint visit regarding quality of care and treatments. They went through a thorough investigation.
Who's they?
The California Department of Public Health, who does these investigations. They went through a thorough investigation over a period of time, and we just got word that there was no violations to that. We also did our own self-reporting. There was a resident who was claiming missing money, so we did our own self-reporting, which means we call CDPH, and we do our own self-reporting. That's still under investigation, and we're waiting for that as well. Department heads. We do have one opening in the department head, and that's the activity director. And we are slowly encouraging one of our existing members. We like to promote from within to potentially maybe take on that role. And so we'll see. We'll see if that's the case. We talked about census earlier today. Our census is increased to 59. Yeah, you can refer to page 21 in your packet as well. That has the census. The current census is 59, 26 are Medicare, 59 are managed, 2 are private, 24 are Medi-Cal, and 2 are on a bed hold. So we're at 97% occupancy, which means that we have 2 that are on bed hold. That's why we're not quite at 100, because we have to account for those 2.
That 59 was our max.
59 is our max. That's correct.
So what were you explaining? There's 2 that are
bed holds, which means that they go out to the hospital or they go out to LOA, which means they go out and visit their families.
So they're a lot of in bed, but they're not here full time, so that's why they don't count 100%. Is that what you said?
That's why we don't get 100% occupancy.
Thank you.
Correct.
Good.
The referrals, where are they coming from? So we got 15 admins from Salinas Valley Memorial, 1 from Natividad, 1 from John Muir Health, for a total of 17. There was a question in regards to total employee turnover, and that is at 2.8% for the first quarter. So I wanted to report that. Also, we have our employees of the all right. So for Eden Valley, we don't have any years of service. Oh, actually we do. We have 1. She's an LVN, and her name is Marlin. and she's been with us for a year. She's our Albion supervisor. We also had a promotion, and I think this is a great kind of story that I need to share with you guys. This individual, Edwin Nava, started with the company over 12 years ago. He started out as a CNA where he worked there for about 8 years. He then went back to school and got his LVN license in 2020. And in 2021, he got promoted to an infection control coordinator. And just recently in 2023, he got promoted to the director of staff development. So this just tells you the longevity of our staff and the commitment that we have in their success here at Eden Valley. And he has stood with us for that many years. Events that happened, we did a fun raffle at the end of March, a laptop raffle, and our Fred Art maintenance person won that. We did Fun Fridays, we did St. Patrick's Day celebration, including all staff meetings as well at Eden Valley.
I noticed, and I walked in also, the 3 bulletin boards on the hallway coming up had pictures, and I saw the Easter Bunny, and there's a lot of things going on.
There is, so yeah, take a look at those. We always try to keep that up to date of activities going on. Another good way is to look at our newsletter as well. Any questions on that before I move on? Okay, so the clinic, they signed an agreement recently with Foundation Labs. Foundation Labs is similar to the LabCorp and the Quest. There's one here in town. So they came to us wanting us to send our business their way, our patients. We were able to secure an agreement in favor of our patients, and it's a long-term agreement with them. And why that's important is because the cost will remain steady and not increase over time. So our patients will benefit from that lower cost to them. And it's a benefit to Foundation Lab because then they don't have to go out looking for patients to get services. We've also updated and upgraded our phone system and voicemail. Our phones continue to stay busy. We are alerting all of our patients that leaving a message is the best solution. Voicemails are retrieved and called back hourly. We encourage our patients to leave a message. And that's been working really well since we made that change. And I think that was brought up in strategic planning, and that was something brought up when I started working here, and it just never had gotten resolved. And with the new leadership, we've been able to get that resolved.
Speaking of, I had problems past where I called, nothing. You've got that circle, you've got nothing. Just recently, I had to call, make an appointment. I left a message. I swear to goodness, within 10 minutes, I had someone call me and say, Mr. Stevens, has anyone helped you yet? No. What can I do to help you? Within 10 minutes.
While you're talking about appointments, I noticed something on the sign, I have a recommendation. So we're talking about if they're not there on time and they're late, that's very important. So if you need them there for an 8:15 appointment, give them an appointment at 8 o'clock. And they come in and check in. So schedule their appointment in that 15-minute window instead of giving them that 8:15 appointment. If they're not here by 8:15, they're late, because you need to be here 15 minutes early, just make their appointment for 8 o'clock and tell them to be on time. And that gives them that 15 minutes before their appointment. Does that make sense?
Tell them to be on time when they're 15 minutes early.
Well, no, because if your appointment's at 8:15, you say you better be 15 minutes early because we have things to do. So you want them here at 8 o'clock. Or give them an appointment for 8 o'clock. Schedule with the provider for 8:15, but tell them 8 o'clock's their appointment time, instead of telling them they gotta be early. It's the same thing, but it's not as confusing to the patient because
It's a different time. My dad told me if you're on time, you're late. If you're early,
right.
you're on time.
And I understand that too, but
not everybody.
They're not getting that. So
Yeah,
that's just schedule their appointment 15 minutes earlier, and then they're on time, and then they get here on time. Because you have that pre-certificate.
We had a sports physical event on the 15th. We had Dr. Pena and Dr. Hidon who supported us there. And these are annual events in support of all of our community and school, sports things that are going on. So we did it, and there was about 30 who attended. This was a Saturday. We will do the sports physicals again sometime in June to catch those students starting school.
That's at the high school?
No, we did it here. We opened the clinic on Saturday.
Oh, it's here.
We did it here on Saturday. We opened the clinic and we have Dr. Hidon and Dr. Pena support us there.
And then were those freebies to the people?
No, there is a cost associated with that.
Oh, there's a cost associated.
Yeah, there's a cost associated.
But doing it at the clinic is cheaper than doing it at the old place, obviously.
And so we will do it again in June of 2023. So look forward to that.
I don't know how it fits in the budget, but I don't know how the Salinas Valley Health Fans, they run all over the county. You know, they go to the schools and they do all that stuff for free at the schools. I'm sure there's a big cost to that. I don't know if they're getting special grants for that, but I do know that they tell my students to come out and they give free sports visitors out there in the little health fan. I don't know how they're funding that or whatever.
Well, at the high schools and the other schools?
In Salinas.
A lot of times the provider or the physician will donate their time to the rule. When my kids were in high school, that's what the doctors did.
Yeah, Salinas Valley brings a mobile van. They're on our high school parking lot once a month, or once a week, and they give free visitors. It's one of the things they give.
I think that the providers donated their time.
They give all kinds of, I get my testosterone shots there, and they give it to me for free. I bring the medicine, and they don't charge me for the shot. And if I went over to their clinic, I would have to pay over. Just I don't know how that applies to us, or if they're getting some grants to do that kind of stuff.
Okay, anything?
Yes, so patients seen at the clinic, you can find that on page 23. Our average per doctor for the month of April is 18. On the OB side, our average per doctor is about 22. So you can take a look at that.
I have one question about that. My understanding is if they're supposed to work 5 days, they only work 3, they take their patient count divided by those 5 days, they come up with an average. It's not an average they're seeing the days they're working, it's an average the days they're seeing if they were working.
It's an average of the days that they're working.
Okay, the providers are telling me that if somebody worked 5 days and saw 12 patients, and somebody worked 2 days and saw 24 patients a day, they're going to have a lower patient count than the one that only saw 12 patients for 5 days, because they're taking the total visits divided by the number of days they would normally work, not the days they work. That's what these numbers seem to show. So like if somebody's out for several days, they're getting a lower patient count.
If somebody is scheduled to work and they don't show up for their day that they're scheduled, that it is being accounted for, because we have to reschedule all of those patients, and that is part of the evaluation.
If they only work 3 days, because that's their schedule, they're only.
It's based on their schedule.
Yeah, it's based on their schedule. Yeah.
Days there.
Okay.
Okay. All right, we still had a staff member. COVID is still around. We had a staff member, actually a provider next door, who actually got COVID. So even though that we've moved on from that, it's still occurring. We had some years of service. We have Nancy Herrera, a medical assistant who's been with us for 10 years. We'll be celebrating her this month. And then we have Rosemary Rivera, who's been with us 15 years, and we'll be celebrating her this month as well. Let's see what else. Let's see. Okay. Coming soon. We have some events. We have a Cinco de Mayo with patients and staff. May 1st through May 5th, we have a potluck and raffle with staff members.
This is for Eden Valley?
This is for the clinic.
Oh, for the clinic.
We do have Nursing Week. I mentioned to you guys, we'll be celebrating it at the both buildings. We only have a couple of nurses at the clinic. We have obviously more nurses here. We'll be celebrating them May 6th through the 12th. Nursing Appreciation Week, and every day there's going to be a special event that we conducted. And then on Mother's Day, a rose for all of our moms, patients at the clinic will receive a rose on Mother's Day as well. What else? Partnerships. This month, I attended the first Soledad Unified School District Safety Committee meeting, where we will focus on emergency crisis response, including active shooter response. Their focus is physical safety, mental health and wellness, and school safety. Secondly, I attended the Soledad Unified School District On Oversight Committee, where I am a chair of that. And I think that's all I have to report.
Any questions about it? Okay,
Okay,
we're going to adjourn into closed session.
that is great.